In the new study, we're building upon work that we've done, which has confirmed that there are adverse effects of repeatedly heading the soccer ball, at least to a very large degree. We know that it has effects on the brain structure. We know it has effects on things we can measure in brain function. What we're looking at now is trying to understand what is going on in the brain of these individuals that is the mechanism by which the brain is not functioning as well when they're exposed to many impacts to the head. We're using special types of MRI, including things such as diffusion tensor imaging, functional MRI, susceptibility mapping, myelin imaging, which allow us to create quantitative measurements of things going on in the brain at a microscopic level. The second question we're looking at is the way in which healthy, beneficial effects of being athletic and active counterbalance the adverse effects of impacts to the head. That actually arises from findings that we have reported previously, where we looked at healthy individuals who are not athletes, athletes without prior experience with collision sports, and then soccer players both with less and more exposure to head impacts. There's a very interesting pattern where when we look at healthy people that are not athletes, they have some level of their brain measurement and their cognitive function. And when we compare those individuals to the athletes without any head impact exposure, no football, no hockey, no soccer, they look better, both in terms of brain structure and brain function. And that's similar in the soccer players who do very little heading. But as soccer players do more and more heading, we see a decline where their brain measurements on MRI and their brain function from cognitive testing looks more and more similar and ultimately at high levels not distinguishable from the healthy non-athletes. This is a really important piece of information because what they've essentially done is given away the beneficial effect of that athletic activity. If we think about the big picture public health agenda, where aerobic fitness has important benefits for health, including potentially reducing risk for dementia and neurodegenerative disease. By incurring those head impacts, if this is borne out in future studies, we essentially negate those beneficial effects. That's the motivation in the current study to explicitly go and measure people's fitness using exercise stress testing.